And while we're doing that, can I just do a quick tech check? When I hit this button, are you all seeing the presentation or are you seeing the part with my notes?
At first, it was just the presentation, but now we also see your notes.
Yeah, we see the presentation screen, so we see the next slide too. And
This has happened before, and it was,
should be that one. Yeah.
okay. So now do you all see my notes?
Yep.
Sorry, just to confirm. Right now you're only seeing the presentation slide and not my notes, correct?
Yep.
We're
Just
only
the
seeing
first
presentation.
slide.
All
Yep.
right. All right.
Stacy, it's Diana. I'm ready.
Great. Thanks so much, Diana. All right, folks, I know we're a couple minutes late, so I'm going to get to us going. Welcome to today's Public Safety and Health Committee meeting. We just a couple of quick items of business. I try to run through this at the top of each meeting for everyone who might be viewing, listening, or rewatching, that you can, even though we're meeting virtually, there's still plenty of ways to reach out to council members. The best way to see what's coming up in our committee meetings as well as council agendas is to visit www.ci.missoula.mt.us/webcast. That's the portal for all of our virtual meetings, and you can see what things are upcoming. And if you would like to ask questions or provide comment on those things, please feel free to email all council members at council@ci.missoula.mt.us. That email address gets a message to all 12 of us on council, or you can always, if you would like, to leave us a voicemail at 406-552-6012. That also gets a message to all members of council. So you have an opportunity to weigh in, ask questions, give comment ahead of meetings if you're not able to attend in person. So we are gonna quickly, I see we only have one member of the public, and it's a member of the media. So unless he'd like to give public comment, he'll raise his hand. Can we do Diana, a super quick roll call vote, and then we'll approve the minutes, and then we'll get to our main presentation from Deshane.
Starting roll call, Stacy Anderson,
Present.
Daniel Carlino. Daniel. John Contos.
Here.
Merta Becerra. Jordan Hess.
Present.
Gwen Jones.
Present.
Kristen Jordan.
Present.
Mike Nugent.
Here.
Jennifer Savage.
Here.
Amber Sherrill.
Present.
Sandra Vasica.
Present.
Heidi West.
Present.
Thank you.
And I do see Daniel's here. He might have just, it was a little out of alphabetical order, so he might not have been ready for to unmute himself.
Yeah, I was having a computer problem, but I'm present. Thanks.
All right, fabulous. So I don't see Miss Becerra. Okay, great. Folks, we have a meeting or minutes to approve from our previous meeting, which was on January 5th, where we had a confirmation of new police officers as well as approval of some purchases from the fire department. Are there any changes to those minutes? Okay, seeing none, those minutes will stand approved. We have one agenda item. It's an informational item to us brought by Ms. Sherrill, who is our representative to the health board. And this could not come at a more apt time. A presentation from our director of the Missoula City County Health Department, Deshane Barnett, about COVID updates, response. And so I will now turn it over to Deshane to present. And Deshane, we have 30 minutes scheduled for this presentation. Would you like questions to come as they come up, or would you like us to hold them all to the end? How do you prefer to present?
Normally I like them as they come up. I will just preface that when I'm in presenter mode, I can't see any of you all. So I'm more than fine with people just hopping in. Just know that you'll have to do so verbally and let me know that there's a question.
Okay, that seems a little awkward. I don't want to interrupt. So unless let's hold questions to the end if we can, folks. And we'll, Shane, take it away.
All right, yeah, and happy to do questions at the end and have discussion based on the information that I'm going to give today. And I just now am noticing, and this is, I apologize, the second meeting that I've done this at where I'm really on top of it. I changed the date on the first page, and then as soon as we hit the second page, it still says December. These are not December's metrics. I apologize. These are metrics as of yesterday, which would be, I guess I should know what the date is. I think January 24th. So 25th, because today's the 26th. So as of January 25th, our incidence rate here in Missoula is up to 212. I do want to talk just a second about this. That's a big jump, and there's a reason for that. At the state level, they have changed how they are reporting cases back to the counties. So before, what happened is they would send the information to us, and then we would have to actually open the case on our end. What the state has done is change their approach. They're saying that, you know, that since they're already doing the back end, getting all of that information ready to send to us, they're just going to go ahead and open the cases as well. So what that's done is created what's called automatic case creation, which means that now cases are going to, at least for a little bit, look like they're much higher than what they have been. And that's actually not true. What it is we haven't been able to open every case that we get every day. We're trying our best, absolutely. But now that's not going to wait. That's not going to depend on us. So actually, this number today is really inflated because yesterday was the first day that the state did automatic case creation. And so there's a lot of backlog there. Moving forward, this is actually going to give us a more accurate picture of cases in real time. So our incidence jumped from Monday to Tuesday. It jumped from 100 and I think it was about 158 up to 212. I expect that'll go down a bit as automatic case creation levels out. That being said, cases are still very high. That's the main thing that you can take away from this is that cases are very high right now. And our doubling time of 6 days, what that means is that we are not yet over the hump of this spike. So we are not at a place where cases are evening out or lessening. Our case numbers right now are still in a spike phase where we're seeing spread of this virus in our community. That's also evidenced by our test positivity rate, which is officially now hitting 30%. That does not count those individuals who have tested positive with an at-home test who have not reported that. And so we've been doing a lot of marketing and pushing information lately about how to do that if you do test positive at home. But there are still individuals who do test positive at home, do not report that to us. So that 30% positivity rate is for those entities who report test results to the county. Our hospitalizations this morning are at 49, and in a couple slides, I'm going to talk about the importance there. And really, as we move into the Omicron variant and into the longer endemic phase of this virus, the part that we now really do need to pay attention to is severe illness and hospitalization. And the situation right now for our hospitals is not great, but I'm going to talk about that in a couple slides. Our vaccines, we are still not where we want to be. And I'm going to show that in a slide or two that the protective nature of the vaccines is still very, very important, even with the Omicron spike. We are not at where we want to be as far as vaccines go. In the beginning of the Omicron spike, just like we saw with the Delta spike, vaccine demand went up by about 0.5% a week. So we were, that for us translates to, we were vaccinating between 100 and 150 people a day. That, for whatever reason, did not last. And the demand now for vaccines is about 30 to 50 a day. And so instead of going up about 0.5% a week, now what we're going up is about 1 0.1% a week, which when we're at 64.8 and our goal is 85, 0.1% a week is not going to get us there quickly at all. And then COVID deaths, we are now at 198. And so again, that's as we move into the long-term endemic phase of this virus, that's what we want to be tracking is serious illness and death. So Omicron hit Missoula, and it hit Missoula hard. And there was understandably a lot of concern and frustration as cases began to rise about availability of testing. I am sharing this information because I just want to highlight that at the Missoula City County Health Department, and these are internal numbers. So when you look at this line graph, these are the number of tests administered just through the Missoula City County Health Department. What we worked very hard to shift our focus and make testing a priority. And so what you can see from this line graph is that the Delta spike that lasted through began in that one uptick in August, but then really was the September, October, and then down through November. We have almost doubled our testing capacity since then, and done so on a dime. What we did was, I think folks probably saw and read in the news that we paused universal contact tracing here in Missoula. So we did not contact every close contact of a positive case. Instead, we shifted our focus to testing and then case investigation. So for those individuals who do test positive, reaching out and making sure that they had the information that they need. Even at that, now we're still, like I said, we're still in this phase where we're seeing more and more positive cases every day. And even case investigation now is not able to keep up. We just received new guidance yesterday from the state of Montana that is allowing local jurisdictions to not only move away from universal contact tracing, but to move away from universal case investigation. And so we have not at the Missoula City County Health Department done that formally yet. I'm going to actually today be asking my COVID subcommittee members to have a meeting, and we're going to discuss what that might look like here in Missoula, moving away from universal case investigation. But as numbers go up, I think it's important that the public understand that there is a capacity issue, and we're not going to be able to contact every single person who tests positive when we're seeing, positive caseloads of 200, 300 a day. And we will absolutely do our best to prioritize those individuals that we know are at higher risk. So people who live in congregate living or congregate care setting. So whether that's a shelter, a long-term care facility, those individuals who are affiliated with a school, whether that's our K-12 or our higher education, and really prioritize reaching out to those cases. And if you happen to be a member of the public who's tested positive, and we're not getting that through either a long-term care facility or school, we're probably going to get to the point where you're not going to hear from us just because you tested positive. What we are going to do is make sure that everyone has the information that they need to isolate appropriately, just like we're doing now to make sure that folks have the information they need to quarantine appropriately. And we will make sure that we have staffing available so that if you email or call us and have questions, if you do test positive, that we can respond to those questions. But it's looking like we're moving to a point in this pandemic where we're not even going to be able to contact everyone who tests positive. That being said, there are many things that we can do to protect ourselves against this virus. And it's all those behaviors that we've learned over the last 2 years, the wearing high quality masks. So hopefully folks have had a chance to see, we've been trying to get the messaging out that N95, KN95, KF94, these high quality masks are going to do a better job at preventing transmission with the Omicron variant, because it's a more highly transmissible variant. And then also reducing interactions, air filtration, all of those things, sanitizing, all of those behaviors that we've learned are helpful. Our best tool, though, is still vaccines. When it comes to preventing severe COVID illness, our best tool is absolutely still vaccines. And this is case data just from the 1 month period of December 8th to January 7th, and because we run about 14 days behind. And what we're seeing is that those individuals who are vaccinated are still experiencing severe illness and death at much lower rates than those individuals who are unvaccinated. So even though what we see is, yes, there are people who are vaccinated who are contracting the virus, which is what we see on the far left graph. There are people who are vaccinated who are even experiencing severe COVID illness, and those are the people in the middle. And then, especially in our older population, age 80 and over, there are individuals who are vaccinated who are still experiencing death. But the proportion of individuals in the vaccinated population who are experiencing serious illness and death are much, much lower than those in the unvaccinated population. And so I wanted to talk just a bit about our hospital capacity. That is, right now, the Missoula City County Health Department, one of our main goals is to try to preserve hospital capacity. With those 49 individuals, throughout last week and this week, it's gone over 50 a couple times. That we hit the hospitalization levels of the Delta spike much sooner in Omicron than we thought we would. It's important for us to remember, and the messaging that we want to get out is that although Omicron has the potential to be a milder variant, milder does not mean mild. This is still a variant of concern, and the Omicron variant absolutely has the capacity to cause serious COVID illness and death, and it is doing that. And the best way to fight that is vaccines, and then practicing all of those behaviors, not reducing interactions, not going places that we don't need to go. The other thing, though, is with hospital capacity where it is, it's time for us to protect our hospitals. Our hospitals have let us know that here in Missoula, just like nationally, we are being impacted by the shortage of blood. That is actually affecting the care that our hospitals are able to give right now. And so I had a meeting with St. Pat's yesterday, and they are actually having to prioritize and ration the blood storage that they have available. So one, we want as many people as possible. Now is the time to give blood, realizing that the Red Cross, like many of us, are also dealing with staff shortages because people are out either with COVID themselves or with family members caring for family members with COVID. And so they're dealing with lower capacity. But there are places that you can give blood drives happening around the Missoula area almost every day. Because of the capacity shortage, several of them are booked out days at a time now. So you couldn't call today and likely go give blood today or tomorrow. But you could make the plan today and go give blood next week. And so we want to encourage people to do that. And then we just want to encourage people, now is not the time to be flooding our hospitals with car accidents due to, it's snowing, icy, but I want to try to go 90 miles an hour, due to hypothermia, I'm going out and not taking proper precautions against the weather. We need to do everything we can as a community to protect our hospital capacity right now to get us over the spike. And it's important that we remember that this is just a spike. This is not forever. This is our national models show that this spike could potentially in Missoula begin tapering off next week. Local models are a little more conservative and say that we should expect despite to taper off around mid-February, because those are taking into account the fact that unlike many places nationally, we don't have mask mandates, we don't have vaccine mandates. So our environment is a little bit different. But still, so we're talking getting through and giving hospitals as much room to breathe as we can over the next 2 to 3 weeks. And so I just want to really encourage folks to have hospital capacity in mind and to get that messaging out. And so with that, I'm gonna stop and answer questions and have discussion and dialogue around where we're at right now. And if there's questions outside of COVID-19 for the health department, happy to answer those as well.
Thanks so much, DeShane. Terrifying number presentation. Really appreciate the plug for blood. Absolutely. I am curious about the, moving away from contact tracing and now case investigation. And I'm wondering, I realize you are dealing with staff capacity as everybody else, but I'm curious on how the governor's decision to end our state of emergency has impacted your access to additional funding to do a lot of this work that is still so, necessary. If you could.
So,
touch
yeah, something important to educate the council members on is that currently we get funding from the federal government for our activities around testing and vaccines. We do not receive funding through FEMA for case investigation, case monitoring, and contact tracing. So if you test positive and we're calling you, if you test positive and we're checking in with you every day on your symptoms, if we're getting a list of people that you've had close contact with and calling them, those duties right now are not being reimbursed at the federal level. So those are coming out of our local city and county dollars. And the county has put ARPA funding toward that. The city has put ARPA funding toward that. But those are finite resources. And what that has meant is that we cannot scale up even if we could, realistically, which I don't think we could, find enough people to fill the seats to make all those calls. We don't have the funding to pay for those seats. What would happen is we would have to actually go back to taxpayers and pass the bill on to them. And we're doing everything we can to avoid that.
Thanks for that explanation. But has that recently changed? Because I feel like there was funding for some of the contact tracing earlier in the pandemic. And it was my understanding, and this is what I'm hoping you can correct, that with the governor rescinding the state of emergency at the state level, it dried up the state resources for things that are not covered under the FEMA national declaration.
My understanding, and Amber or anyone else on here who might have more information than I do, is that the funding for case investigation, monitoring, contact tracing, actually FEMA is the one that made the decision not to cover those activities anymore. But what we did lose originally when we lost our state emergency was the funding for all of our congregate shelter work. So for those individuals who say are staying at the POV and if they test positive, we don't want them in that congregate living environment. We had what was called the non-congregate shelter, and that funding had gone away. My understanding also, though, is that our amazing Office of Emergency Management and Adrian Beck were able to get approval to have those services refunded absent the state of emergency. And that was a new thing that just happened, I think, about a month ago. But yes, there absolutely was a time when not having that state of emergency impacted our ability really to serve the most vulnerable members of our community.
Thanks for that. All right, I have questions and comments from Ms. Cheryl.
Yeah, thanks. And thank you so much, DeShane. And my memory of it, which, just like the virus, this is morphine. seems like very quickly, but was that what Stacy had said for a period of time was correct, but I'm not totally sure about that because it has kind of morphed along the way. So first, I want to say thank you to Deshane for being here and taking your time. I know how incredibly busy we are and you are, and also working to make sure that our health department doesn't collapse under the weight of this and being strategic about that. So I really want to make sure people understand that he has jumped in to this job at a time that we kind of thought maybe it was over, and it's been really challenging. So I have one question beyond those comments, and with regard, what you're outlining, Deshane, is really that the hospital numbers are, I don't know if we've hit records under this, but they spiked early because of so many cases, even though hospitalizations are lower than with Delta, but by sheer number, which I've talked about this in some city council meetings, even if it's a lower percentage, you're going to be flooding into the hospitals, right? So that's become a strain on the hospitals, but also similar to every business in the health department and so on, that the number of staff in the hospitals that have been out one report I saw went well beyond the number of staff that were out for COVID during Delta. So it's like this ugly, perfect storm of, and add the blood shortage to it. But could you speak a little more to what that's doing, and maybe also how we've implemented in the past and may need to in the future, maybe not, the National Guard under that program?
Yeah, so in speaking with St. Pat's yesterday, and I haven't had a chance to catch up with Community Medical Center since last Thursday, so it's almost a week out, except an email on Monday that I didn't get into details. But I did get to meet with St. Pat's yesterday, and they've been experiencing, on average, about 40 staff members out. They call them caregivers. So they've had 40 caregivers out, but even on one day they had all the way up to 90, which for them was a record. And so they are dealing with really unprecedented workforce shortages. And we have now at St. Pat's, the administrative team and doctors are volunteering to do food service and janitorial, because absent workers, hospital patients still need to be fed, things need to be cleaned, sanitized. And so what we have is doctors who are actually volunteering when they're not on their doctor duties to come in and do these other duties, and same with admin, which I think is commendable. We also, though, want to make sure that that's not sustainable. And we want to make sure that we are protecting hospital capacity as much as possible. And what we have seen is that the hospital numbers, so as far as, at 50, our highest during Delta, I think, was 58. So we haven't hit in individual beds exactly where we were at with Delta, but we hit this much sooner, and it's potentially going to go for much longer because this strain of the virus is more transmissible. And so what's going to happen is we're going to be putting a significant strain on our hospital for a longer time. Because of that, the Missoula City County Health Department and the Missoula Office of Emergency Management did sign off on the request for National Guard for the hospitals. I think that was Monday. And so that request is in the process of being made. I don't know yet what that would look like, if that request will be approved, if it's approved, how many we will get, for how long, when they'll get here, but that request has now gone back in.
May I have a follow-up, Chair?
Yes, you may.
Thanks, Deshane. And I'm glad to hear that we put that request in, because we need to give these people some relief. We need them, our caregivers, getting sleep as well and being clear-headed. Would you speak a bit to home testing? I know that we can get those sent via the federal government, but home testing, how you would recommend people treat results around home testing and so on.
Yeah, so we just put out a press release last week, and there, if you go to missoulainfo.com, there absolutely is information on how to report yourself if you've tested positive via an at-home test. Something else I wanted to mention about at-home testing just testing in general, if only 1% of Missoula wanted a test, we are looking at that's 1,200 tests in a day. Our testing team, they've beefed up capacity. We are now averaging 4 tests every 5 minutes. If we kept up that pace and only 1% of Missoula wanted tests, we would need 25 hours in a day to complete that amount of testing. Missoula City County Health Department cannot be doing all the testing. So on that though, the great news there is that we are receiving a shipment of at-home tests. The Missoula Office of Emergency Management has graciously volunteered to be in charge of receiving and then distributing that. So we are actually going to be at Fort Missoula, not we, it's the county, but it's Office of Emergency Management, not the health department, is going to be at Fort Missoula this weekend, handing out tests to every household who wants one. And so there is a limit of either, I think it's 1 or 2 per household. And the Missoula Office of Emergency Management is getting the word out about that, coordinating that. So we are also doing everything we can to get at-home tests to the public. That being said, we absolutely want folks, if you test positive, to continue to report, and you can do that through MissoulaInfo.com. And sorry, I know I'm running over my time, but this is all really good information.
Absolutely. No, it's good. We are eating into council members' theoretic lunch break, but virtual meetings do allow us to eat at our desk. So this is really important information that I want to get out to the public. So we will continue on leaving a little bit of time to switch out staff for our next meeting, but we'll continue on with questions and comments. And next on the list is Mr. Carlino.
Thanks. Yeah, on the testing note too, now the federal government is offering a 4-pack of tests shipped home to anybody from the USPS. So just helping get that word out. But Deshane, I know we were emailing back and forth about possibly opening up other testing sites in town after Vicki Watson was asking about that, just one like more closer to the city center. And I was wondering if you had any updates on that for us, and always know that you can reach out to the city or county to ask for proper funding if we need help to get things like that up and running.
Yes, so the University of Montana Remote Testing Station, which is a partnership between the City County Health Department and University of Montana, opened today. So that is for students, staff, faculty of the University of Montana. We are also working to open another one at the Election Center. And I just talked to Bradley last night, and I don't remember when the launch date for that one is. It's coming up very soon. So it'll either be before the end of this week or early next week, I believe. And that one is for the members of the public in general. And so we will absolutely get that information out as an additional resource as soon as that is up and running.
Great, thanks for that. And where can the public go to find out those testing locations?
MissoulaInfo.com. So on MissoulaInfo.com, not only do we list all of the testing locations that we are, a part of, whether it's county operated or in partnership, but we also list options for places to get tests if it's not us. So Cost Care, Walgreens, CVS, online retailers. If you go to MissoulaInfo.com, there you can find information on testing.
Great. So that is your one-stop COVID resource. And I know that there's also a phone number for those who maybe don't have as great of access to computers. Would you mind saying that for the record? And I know we have press in attendance today. Yeah,
no, and that's, we do want that number out there. So it is 258-INFO. That being said, that is our one line in for all things COVID. And because of the demand for testing, and that is part of the county phone system, the demand is causing long wait times and crashes of that phone system more than what I would like. Our county IT is absolutely every day they're working to beef up the ability for that phone system to handle more calls. But right now I understand frustration when people call that number. There is the potential to be online. To be on hold for a while. But for those individuals who don't or can't access the internet, 258-INFO, you can also call for information.
Great. So go online if you can, leave phones for those who don't have access online. Ms. Vasika.
Thank you. So I've had constituents ask me, does it matter if you're vaccinated or unvaccinated if you want to give blood?
Oh, so Missoula City County Health Department does not actually coordinate the blood drives. That's the Red Cross. And that is an excellent question. And I do not know the answer, but I can absolutely reach out and find out.
Great. Thanks for that. Okay, so I don't see any more questions. We don't have any more public, or we don't have any public to make comments, but I thank you so much. I think that the summaries here are: people get vaccinated. Millions of vaccines have been given across the globe. It is safe and it is the best way for you to protect, and we need to get to 85%. So lots of ways to do that. And stay home if you can, do all the things that we've learned. Oh, I do have a question about N95 masks. There's been a lot of news about that. And I know I personally have been trying to find one. Do you have any guidance for those of us who are looking to get our hands on one of those to use on the rare occasion we do have to go out?
I've not heard of any supply shortage around N95 masks here in Missoula. And if that does occur, we will absolutely work to make them available, just like we're doing with the at-home testing. But as recently as last Friday, when we checked in with retailers here in Missoula, the supply of N95 masks or K95, KN95, or KF94, which are the three very high quality masks that are being recommended right now by the CDC, the supply was still largely available. And even I met with a local business who is going to be doing a very public event in February, and they had mentioned that they were able to procure a large number in bulk of N95 that they're going to make available for people who participate in that event. So I have not heard anything yet about, in the early days of the pandemic, yes, N95s were very hard to come across, and we wanted to reserve that supply for our healthcare workers. But we did check in before we put out that messaging about N95s. We checked in with both hospitals, with both FQs, which is Partnership Health Center, All Nations Health Center, and with some other healthcare providers. And healthcare providers have not reported a lack or inability to procure N95 masks. So I would hope that everybody, we had put out in our press release, Home Depot, Walgreens, CVS, a couple of stores. We had called, I think, 4 or 5 stores that all said yes, they had plenty of supply.
Perfect. I really appreciate the messaging. I just don't leave the house very often. So the 1-2 places I go just didn't have them. So thanks for that. I don't know if anyone has any other questions, but this is so informative. Thank you for the press for being here in today's meeting and publicizing this information. We are not at our peak. This is only milder, not mild. And, everyone needs to do their part to keep our community safe. And DeShane, I really look forward to the time when all of us can appropriately thank you and your staff just for the amazing, amazing work that you are doing and being called upon, and all of our healthcare workers, doctors doing janitorial service. It literally is taking everyone doing their part so we can do ours as well. So thank you so much. Do you have any parting words before we sign off, DeShane?
Just that I hope, I know some council members have reached out to me. If you have ideas, suggestions, concerns, thoughts, please reach out. I take those very seriously. And if there are ways that we can, do more with less, because unfortunately that's just the situation that we're in, we will always explore how to do that.
Great. So you are also MacGyvering your way through this. So, okay, thank you so much. Everyone give blood. That will be all for today's Public Safety and Health. I know that we went a little bit over. Our next meeting on the docket is Parks and Conservation at 11:55. So thank you so much, everybody, and continue to be well.